Hey guys, welcome to another episode of EMG's Talkabouts. I'm Damian Navarro, one of the managing partners here at the agency, and I'm being joined here with Dr. Blaine Behringer, another one of the managing partners here at EMG. So we're really excited to bring you Chapter 2 in our Healthcare Roundup. Today we're going to be talking a little bit about faith-based systems, and I don't know if you know this, but the Journal of General Internal Medicine says that about 20% of all hospital systems have some sort of religious affiliation. Over the years, EMG has been given the opportunity to work with some of those, and we'd like to talk a little bit about those experiences, as well as hopefully you guys can learn a little bit about what makes those so unique and some of the challenges that they're facing even today. So, Blaine, one of the first questions I have is, how does that large competitor pool of going up against many other traditional hospital systems differentiate the way that a faith-based system might market itself differently?
Well, EMG has had the fortunate opportunity to work with a number of faith-based institutions as well as non-faith-based institutions. I think at the end of the day, all medical centers or hospitals are trying to make people well. And so they both have very common missions. They just do it in a little bit of a different way. But in the same token, from a marketing standpoint, they're trying to accomplish the same thing, which is get patients in the door. If there's access in a clinic, fill the clinic up. And so what we find is that the process of marketing to a consumer for a faith-based institution is very similar to that of a non-faith-based institution, but the value proposition, the message, changes slightly. So a non-faith-based institution might market itself more around its technology or its rankings or something like that, where a faith-based institution might market itself more around values, around whole person care, around spiritual care. And so and consumers react differently depending on what they're looking for in their overall healthcare consumer seeking. And so depending on what the objective is of the institution that we're working with and how they portray their brand either online or offline, we work to craft messaging and advertising that fits that model.
Gotcha. Would you say that there then is much more of an opportunity to experiment but also to test what's resonating with different types of consumers? Because you had already mentioned that, have you found that maybe the religious affiliation sometimes turns them off? Or maybe you could talk a little about the type of testing that we've done.
In terms of testing, I think there's a lot that can be done in the online space very quickly, where you can test different value propositions and messaging and really understand the different target audiences you're trying to reach and what you can do to attract those target audiences, whether it be a value proposition based on a faith-based institution and the values that that institution is trying to portray, or whether it's on specialty care or on some other value proposition. And the great thing about online marketing is you can test those all the time and make a decision on which works best and brings the overall return on investment.
I agree. Is there any type of sensitivities that you've seen as you start to first engage? Maybe, because I know a lot of faith-based systems are sometimes a little farther behind the curve, or they've never really worked with an external agency, and I know there's some sensitivities coming on that, how important it is that they really understand and get what's happening there, both from a kind of a wellness, spiritual side, as well as obviously from a service perspective. Do you have any real-world case studies or some real-life experiences that you've really experienced those kind of sensitivities, and how were those overcome?
Sure. I think probably the biggest thing in working with a faith-based institution is that they're a little embarrassed to market. They're a little, they're not as, I wouldn't say they're not as business savvy, but because they certainly are, they're just not as prone to talk about themselves.
Right.
They're a little more humble. And so sometimes we come across faith-based institutions that say, oh, we don't really say that about ourselves. And we say, well, that's what consumers are looking for when they're searching for care for this type of disease process. You need to say these things about yourself. You're the best at this type of care. You provide the best type of treatment in this geographic area. And by saying those things, it may not be as humble as maybe the institution has marketed itself in the past, but it does provide the consumer with the language that they're looking for to make a decision on a facility. So it's always just a fine line, helping the institution understand what they need to say and how that fits with their overall brand message.
So basically that marketing isn't necessarily a bad word when done ethically, and that they could still get so much out of it by simply exposing the stories and what's happening there to the larger audience.
Correct. And at the end of the day, I mean, the mission is to get people well.
Right.
And so by marketing your true strengths and your values and the message of the institution, you're getting people to the hospital or medical center and ultimately making them better. And so in the end, you're accomplishing the mission.
Very cool. I totally agree. Well, thank you guys so much for tuning in for that, Blaine. Thank you so much.
You're welcome.
That was really, really good. Obviously, we have a lot of information on our website at www.visitemg.com on our experience of working with different institutions such as Loma Linda University Medical Center, Seventh-day, some of the Seventh-day Adventist institutions as well as others, and would love for you guys to take that out and explore it. So thanks again, and we'll see you guys again soon.